weekly series, The Doctor is in. Still with us, Dr. Mark Siegel. You know him from the show. The Doctors is OBGYN Dr. Lisa Masterson. And joining us is dentist Dr. Edward Gottesman. Mikey, actually, before we get out to our audience questions, the swine flu. What's the update?
We've got to get rid of the fears of the swine flu because it is a new strain, but it's not transmitting all over the place. And the key thing is it's actually mild. We're worried about that word pandemic, but the truth is that this is something we have to monitor and watch, but it is not something that is going to get you.
Hey.
Pigs do fly, the swine flu. But we have a swine flu-related question, okay?
Okay.
Tell me about your son.
My son was diagnosed with juvenile rheumatoid arthritis a few years ago, and he's off medication now. What are the chances of, if he did get it, for any symptoms to come back?
He's 19, diagnosed at 12.
Does he take any steroids or medications
Not right now. He's been off meds for 2 years.
That's good news. Now, the flu in general, again, the yearly flu is something we really are concerned about. This may become the yearly flu next year. The yearly flu can actually bring on the symptoms of this, so you have to watch it. Anyone with chronic illness or asthma or underlying conditions, that's what we really watch out for with the flu. He must have a flu vaccination, and if he gets the flu, he has to be treated quickly for it.
Another question here, folks.
Hi.
Go ahead.
I'm single, over 40, and have been diagnosed with HPV. And my doctor recommends Gardasil to prevent any future strains of HPV. But I haven't read anything about it for anyone over 26. I don't know what to do.
Dr. M?
And it's not too late. Basically, we're trying to really encourage young women to take it because those are the most risk. But that doesn't mean if you're sexually active and you're older that you can't. It only covers 4 strains, but it's not going to hurt you.
Can you tell us what it is? What is it?
Gardasil is...
the HPV.
HPV stands for human papillomavirus, and it's the virus that's associated with cervical cancer and genital warts. And so it's really, this vaccine, can basically wipe out cervical cancer, which is really, really great. So it's very important for women to start it when they get sexually active. That's why the emphasis has been on giving it to women really, really young. But if you've sort of missed that and you're in the older bracket right now, you certainly can get the Gardasil vaccine.
Is it true that over the age of 50, more than 80% of American women will have HPV?
That's absolutely right.
That's because they haven't been vaccinated for it?
Right, absolutely. And because it's a sexually transmitted disease, it goes without any symptoms, so you have to be screened for it. Your doctor can do it with your pap smear.
Okay.
Let's have a question for the dentist. What do you think?
I grind my teeth at night, and I'm developing a TMJ problem. What can I do about it?
Well, there's not much you can do about stopping yourself from grinding. Most people who grind will find that when they wake up in the morning, they've been clenching all night long, so their muscles create a headache. A lot of times a spouse or a partner will tell you that you grind your teeth at night because they're not sleeping. What you could do, though, is you could actually go to your dentist and ask for a mouth guard to be made, which is basically like a football mouth guard that will actually help to reduce that clenching and the wear on your teeth.
And it's also stress, right? Stress.
Yeah. You've got to treat the stress that may be underlying
stress.
it. That's
The
right.
important thing is to try to tackle the stress, which isn't always easy.
Okay, question here.
Morning.
Hi.
Hi. Having been on the pill for a long time, like a decade, how long should I wait to come off the pill in order to get pregnant?
Do you want to get pregnant now?
Soon. Sure.
Mike.
Look at me that way. How long? Well, goodness gracious.
You have to watch out for this.
Will you hold this?
Man has
I know.
things on his...
What did you just...
No, how long? How long should you be off the pill for to get pregnant?
We have to be careful of you, don't we?
No getting phone numbers from the audience, Mike. No getting
Dr. Masterson, you have no idea.
Hey, I know.
No idea.
I'm getting an idea here, but no. A lot of women think they have to stay off for a long time. You don't, because it gets out of your system right away. It's not going to cause any birth defects if you get pregnant on it. So usually we just recommend 1 to 2 months because your cycle will need to come back. But you're fine.
We're good?
All right. Great questions, great answers. Thank you guys very much. We appreciate it. Coming up next, the Boxer Rebellion. The Dog Whisperer is here, and he is going up against an 85-pound boxer who thinks he's a lapdog. Can Caesar go the distance?